Greetings. I am Gary Slick, the designated institutional official of the resident and fellow graduate medical education programs at Oklahoma State University Medical Center. Welcome to the 75th graduation ceremony of OSU-MC. We are very disappointed that we could not celebrate this special event with a traditional graduation ceremony. However, this 75th celebration is a very special milestone for all of the interns, residents, and fellows who have graduated from this institution in the past, and we are especially proud of the osteopathic physicians that will be presented for graduation today. We will be celebrating and recognizing graduates from both our OSU-CHS sponsored programs and our OMICO sponsored programs who have had their hospital-based training at OSU-MC. Graduate medical education started here in 1944, the same year that the newly purchased hospital, then named Oklahoma Osteopathic Hospital, was opened. Within a few weeks after the doors of the hospital were opened, the first intern, Dwight Honeyegger, began his internship after completing his training at the Kirksville College of Osteopathic Medicine. Dr. Honeyegger completed his internship in June of 1945, and his graduation was the start of 75 years of a long line of outstanding interns, residents, and fellows training at OSU-MC. This year's graduates bring the total number of trainees to 2,631. During the first 25 years since 1944, 6 residency programs were established. The first residency program was in general surgery, which matriculated their first resident in 1952. This was followed by diagnostic radiology in 1956 and internal medicine in 1957. 9 years later, 1966, pediatrics matriculated their first resident, followed by ophthalmology in 1967 and otolaryngology in 1970. That was the first 25 years of internship and residency education. Over the ensuing 50 years were added several additional new residency programs, plus the first fellowship in cardiology in 2003. Over these 75 years, this institution has had a rich tradition of producing outstanding physicians who have served the patients of this nation, the state of Oklahoma, and especially rural Oklahoma. We would now like to turn over the podium to Dr. Robert McCullough II, an oncologist who served as attending physician and faculty for several years in the internal medicine department, and who also started his training at this institution as an intern. His father was the secretary-treasurer of the Board of Trustees when this hospital was purchased, and we have asked him to give a few comments of his firsthand knowledge of the opening of this hospital and the beginning of graduate medical education in those early years. He will be followed by Dr. Dennis Blankenship, Senior Associate Dean of OSU-CHS and Professor of Emergency Medicine, who will be giving some congratulatory comments to this year's graduates. and then followed by Dr. Richard Schaefer, President of the Oklahoma Osteopathic Association, will give his greetings. Dr. McCullough.
Hello, I'm Dr. Robert McCullough. The origin of Oklahoma Osteopathic Hospital, now Oklahoma State University Medical Center, is a story of risk, commitment, and success. In 1943, the osteopathic profession was renting a 25-bed hospital at 14th and Peoria, where I was born in 1937. Growth of the profession and the desire to control their own destiny led the 10 osteopathic hospital founders to put their own money and credit on the line. My dad, then a 30-year-old surgeon, the secretary-treasurer of the founders, took the $35,000 bid to the courthouse steps in November 1943 and bought the 40-year-old empty hospital at a federal mortgage foreclosure sale. That building stood where the present East 8-story tower now stands. I recall the excitement of my dad as we walked through the hospital in 1944 as it underwent renovation and updating prior to its opening in December 1944. It had 65 beds. In the early days, the founders had to chip in more of their own money to keep it open. Dad told me that if one of the original founders were replaced on the board, the replacement had to accept the responsibility if it became necessary to repay the debt. He laughed and said there were no board replacements for several years. When I interned at OOH in 1962-63, by then a 200-bed hospital, one of the longtime nurses told me that she used to buy light bulbs to bring to work for the hospital. One of the bywords used by the old-timers was to refer back to when we had the ramps, since the 4 floors were connected by ramps, there being a number of years before further renovations resulted in elevators being installed. Interns, residents, and even the attendings were expected to help with the job of pushing gurneys up the ramps. I'm sure that the first intern, Dr. Dwight Honeyegger, also a second-generation DO, pushed his share of gurneys up the ramps. All of this to say that you have a great heritage from the risk, commitment, and success exemplified by the founders. I salute the graduating residents and fellows and challenge you to uphold and further the dedication of our founders to our profession and your patients. May the Lord bless you as you take your next professional steps.
I'm Dr. Dennis Blankenship, Interim Senior Associate Dean of Academic Affairs at OSU Center for Health Sciences. On behalf of the leadership at OSU Center for Health Sciences and the OSU A&M Board of Regents, it is my honor and privilege to congratulate you on this remarkable accomplishment. Celebrating this milestone in your life via a virtual format was not what you envisioned when you started your residency program. Please know that we, the faculty, staff, and administration at OSU Center for Health Sciences, share your disappointment and sadness. COVID-19 has turned our world upside down. This health crisis has forced us to re-engineer how we do things and rethink how we interact with each other. But the unusual circumstances caused by COVID-19 does not detract from your accomplishments. In fact, it has made us even more proud of you and your accomplishments. You are the 75th residency class to graduate from OSU Medical Center. This is a hallmark year for our institution. You represent 75 years of excellence and resilience that our programs at OSU Medical Center have had on osteopathic residency training. You have represented us well. Residency training is hard. The hours are long, the work is grueling. On top of all that, you trained in the midst of a global pandemic, risking your life and health in order to care for your patients. We are proud of you, proud of your hard work, resilience, courage, dedication to patient-centered care, and commitment to the ideals of osteopathic medicine. We have no doubt you will continue to care for your patients and serve your communities with compassion and humility, and that you will continue to make us proud. Thank you for all you've done for our state, our university, our patients, and for OSU Medical Center. Once again, congratulations.
Hello, I'm Dr. Richard Schaefer. On behalf of the Oklahoma Osteopathic Association and as its president, I want to congratulate you on your residency and fellowship graduation. I wish I were there in person to offer my congratulations, but unfortunately, That's impossible. Yes, we are in a crisis. We don't know how long this will last, but as physicians, we know that we'll come out of this and see the light. But without doubt, there will be future crises and challenges. We must work together to face them because along with the medical ones, we continue to face political challenges. We must fight to protect our future in medicine and most importantly for our patients. Please help me and your representatives on the Oklahoma Osteopathic Association Board. Join us as a member and be active. It takes all of us working together. Again, congratulations to you and to your family who has supported you throughout this journey. The OOA extends our very best wishes.
We now begin the highlights of this ceremony. We will ask the program directors to present their graduates. Unfortunately, because of the COVID-19 CDC guidelines, we will be unable to have the residents and fellows appear in person. The program directors will present each graduate and provide some information as to where they will be entering the next phase of their career. The first to start will be Dr. Brad White, Program Director for the Anesthesiology Residency Program. Dr. White.
Hello, I am Dr. Brad White, the Residency Program Director for the Anesthesia Program at OSU-MC. The Anesthesiology Residency Program matriculated our first resident in 1972. Since that time, we have graduated a total of 68 residents. We have 2 residents completing the program this year. I am now proud to present this year's graduates. The first is Maxwell Century, who has joined U.S. Anesthesia Partners at Houston Methodist West in Houston, Texas. Next, we have Christopher Thompson, who has joined St. John Medical Center in Tulsa, Oklahoma. This completes our graduating anesthesiology class for 2020. The next program is Emergency Medicine and will be presented by Dr. Aaron Lane.
Hello, I'm Dr. Aaron Lane. The Emergency Medicine Residency Program matriculated our first resident in 1985. Since that time, we have graduated a total of 107 residents. We have 4 residents completing the program this year. I am now proud to present this year's graduates. The first is Dr. John Carlson, who has joined the OSU Department of Emergency Medicine in Tulsa, Oklahoma. Second is Dr. Shane Natusko, who has also joined the OSU Department of Emergency Medicine in Tulsa, Oklahoma. Third is Dr. David McAdams, who has joined the St. Joseph's Regional Medical Center in Lewiston, Idaho. Last, we have Dr. Matthew Smith, who has joined U.S. Acute Care Solutions in Tampa, Florida. This completes our graduating emergency medicine class for 2020. The next program is Family Medicine and will be presented by Dr. Laura Cotton.
Hello, I'm Dr. Laura Cotton. The OSU-MC Family Medicine Residency Program matriculated our first resident in 1989. Since that time, we have graduated a total of 182 residents. Completing residency training is a remarkable milestone in your life and career. It's been an honor to be your program director. As you move on to do the important work of caring for patients, I wish you much success and happiness. We have 7 residents completing the program this year. I'm now proud to present this year's graduates. The first is William Anthony, who has joined Stillwater Medical Center in Stillwater, Oklahoma. Second is Kristen Baker Hankton, who has joined the Utica Park Clinic in Bixby, Oklahoma. Third is Andrew Crow, who joined St. Luke's Hospital in Kansas City, Missouri. Fourth is Michael Heitzman, who has joined St. Francis Hospital in Veneta, Oklahoma. Fifth is Kathleen McGovern, who is undecided. Sixth is Keelan O'Neill, who has joined Panacea in Huntsville, Alabama. Last, we have Jason Postlethwaite, who is also undecided. This completes our graduating OSU-MC Family Medicine class for 2020. The next program is OMICO Family Medicine and will be presented by Dr. Sarah Hall.
Hello, I'm Dr. Sarah Hall. The OMICO Family Medicine Residency Program matriculated our first resident in 2014. Since that time, we have graduated a total of 12 residents. We have 4 residents completing the program this year. I remember 3 years ago when you all started, bright, cheerful, motivated, and full of energy. Over time, I have seen these qualities change throughout residency. However, for whatever reason, your class did not ever lose any of those important qualities. I know each one of you bring that zest for life and the curiosity to assist your patients every day you report for work. Through your residency journey, you have matured, become more confident, and are now able to handle the most complicated conditions in patients. You truly embody the osteopathic physician. You all consider the body, mind, and spirit for each one of your patients. I cannot begin to tell you how very proud of each one of you I am today as you graduate from residency. I have grown as a program director and as a person because of each one of you. Thank you for choosing OMICO Family Medicine almost 4 years ago. You all have achieved your dream, and while I know that this is a new beginning for you, remember that you will always have a home and a family with us at OSU. Please don't ever forget the words spoken by William Osler. The good physician treats the disease. The great physician treats the patient with the disease. Continue to strive for excellence in all that you do. I am now proud to present this year's graduates. The first is Dr. Kimberly Barron, who will be doing a sports medicine fellowship at the University of Arizona in Tucson, Arizona. The second is Dr. Rebecca Kriegsman, who has joined Warren Clinic in Muskogee. Third is Dr. Joshua Redmond, who has joined the Utica Park Clinic in Pryor, Oklahoma. And lastly, we have Dr. Glenda Tiller, who has joined the OSU-OMICO Family Medicine Department in Tulsa, Oklahoma. This completes our graduating class from the OMICO Family Medicine for the class of 2020. The next program is Internal Medicine and will be presented by Justin Chronister.
Hello, I'm Dr. Justin Chronister, and will be presenting the internal medicine graduates for this year. The internal medicine residency program matriculated our first residents in 1957. Since that time, we have graduated a total of 251 residents. The 10 graduates of this year's class truly stand out as some of the very best we've ever had. They're an impressive group of incredibly bright, hardworking leaders who will leave this program and this institution far better than how they found it. It has meant so much to me to have watched you all grow and develop over the last 3 years. I've seen you forget to hold guide wires. I'm looking at you, Hebert, and I've seen you save countless lives. And I'm also looking at you, Hebert. I've seen you dedicate yourselves to others, sacrificing family and friends, all for the greater good of your patients and your family here at OSU. I love you, I respect you, and will never be able to truly express how proud I am of you. It is my utmost privilege to present this year's graduates. First is Divya Akula, who has joined St. John Medical Center in Tulsa, Oklahoma. Second is David Alcorn, who has joined Hamilton Medical Center in Dalton, Georgia. Third is Robert Aaron, who will be doing a gastroenterology fellowship at St. Francis Hospital and OSU Medical Center in Tulsa, Oklahoma. Fourth is Jason Bass, who has joined St. John Medical Center in Tulsa, Oklahoma. Fifth is Hannah Crow, who was doing an endocrinology, diabetes, and metabolism fellowship at the University of Kansas Medical Center in Kansas City, Kansas. Sixth is Lindsay Ford, who has joined St. John Medical Center in Tulsa, Oklahoma. Seventh is Michael Hebert, who has joined Harris Methodist Hospital in Fort Worth, Texas. Eighth is Deb Jaswal, who will be doing a cardiology fellowship at OSU Medical Center in Tulsa, Oklahoma. Ninth is Kelly Natarajan, who has joined St. Francis Hospital in Muskogee, Oklahoma. And last but certainly not least, we have Patrick Neff, who has joined St. John Medical Center in Tulsa, Oklahoma. This completes our graduating internal medicine class for 2020. The next program is obstetrical and gynecology and will be presented by Dr. William Poe.
Hello, I'm Dr. William Poe. The OSU-MC Obstetrics and Gynecology Residency Program matriculated our first resident in 1980. Since that time, we have graduated a total of 56 residents. The program has gone through thick and thin, but is stronger than ever, and these residents are the most passionate I've had the pleasure to work with. We have 3 residents completing the program this year. I'm now proud to present this year's graduates. The first is Deidre Duncan, who has joined Premier Women's Care of Southwest Florida and Fort Myers, Florida. The second is Ashlyn Paz, who has joined the Sweetwater Hospital Association in Sweetwater, Tennessee. Last, we have Luann Solis, who has joined the Comanche County Memorial Hospital in Lawton, Oklahoma. This completes our graduating OSU-MC Obstetrics and Gynecology class for 2020. I will now present the OMICO Obstetrics and Gynecology program. The OMICO Obstetrics and Gynecology Residency Program matriculated our first resident in 2014. Since that time, we have graduated a total of 12 residents, and these residents are among the best and brightest, and I will miss them when they're gone. We have 2 residents completed the program this year. I'm now proud to present this year's graduates. The first is Gloria Perez, who has joined Southlake OBGYN in Claremont, Florida. Last, we have Michael Wright, who will be doing a fellowship in minimally invasive gynecologic surgery at St. Luke's Hospital in Allentown, Pennsylvania. This completes our graduating OMICO Obstetrics and Gynecology class for 2020. The next program is Ophthalmology, presented by Dr. Ryan Conley.
Hello, I'm Dr. Ryan Conley. The ophthalmology residency program matriculated our first resident in 1967. Since that time, we've graduated a total of 54 residents. We have 1 resident completing the program this year. I'm proud to present this year's graduate. Sawyer Hall has joined the Associate in Comprehensive Ophthalmology at Hall Eye Clinic in Marshall, Texas. This completes our graduating ophthalmology class for 2020. The next program is orthopedic surgery and will be presented by Dr. Brent Norris.
Hello, I'm Brent Norris. The Orthopedic Surgery Residency Program matriculated our first resident in 1970. Since that time, we have graduated a total of 56 residents. We have 2 residents completing this program this year. I am now proud to present this year's graduates. The first is Imran Akhtar, who will be doing a fellowship in adult reconstruction and arthroplasty at the Desert Orthopedic Center in Las Vegas, Nevada. Next is Mr. Jake Henry Whitener, who will be doing an orthopedic sports medicine fellowship at the University of Cincinnati in Cincinnati, Ohio. This completes our graduating orthopedic surgery class for 2020. The next program is otolaryngology and will be presented by Dr. Tom Hamilton.
Hello, I'm Dr. Tom Hamilton. The otolaryngology residency program matriculated our first resident in 1970. Since that time, we have graduated a total of 39 residents. We have 1 resident completing the program this year. I am now proud to present this year's graduate. Chase Nelson has been a joy to have in the program. His positive attitude and compassion for his patients has strengthened the program and set the standard for future residents. Dr. Nelson has joined Minidoka Memorial Hospital in Rupert, Idaho. This completes our graduating otolaryngology class for 2020. The next program is OSU Medical Center Pediatrics and will be presented by Dr. Shauna Duncan.
Hello, I'm Dr. Shauna Duncan. The OSU Medical Center Pediatric Residency Program matriculated our first resident in 1966. Since that time, we've graduated a total of 107 residents. We have 4 residents completing the program this year. I'm now proud to present this year's graduates. First is Dr. Taylor Kraft, who has joined St. Anthony SSM Health Outpatient Clinic in Oklahoma City, Oklahoma. Second is Dr. J.C. J. Hutchinson, who has joined the Stillwater Medical Center Pediatrics in Stillwater, Oklahoma. Third is Dr. Emily Pierman, who has joined Columbia Memorial Hospital Pediatric Clinic and Newborn Nursery in Astoria, Oregon. Last, we have Dr. Caitlin Shady, who has joined Integris Hospital Clinic and Nursery in Grove, Oklahoma. This completes our graduating OSU Medical Center Pediatric class for 2020. The next program is OMICO Pediatrics and will be presented by Dr. Laura Bodie.
Hello, I'm Dr. Laura Bodie. The OMICO Pediatric Residency Program matriculated our first resident in 2014. Since that time, we have graduated a total of 24 residents. We have 5 residents completing the program this year. I am proud to present this year's graduates. The first is Betsy Katapuram, who has joined ABC Pediatrics in Killeen, Texas. Second is Rachel Kirkman, who has joined Ascension St. Vincent Clinic in Evansville, Indiana. Third is Christina Miles, who has joined Community Health Center of Richmond in Staten Island, New York. Fourth is Hong Wen, who is undecided. Last, we have Arslan Rashid, who has joined the Auburn Medical Pediatrics Clinic in Auburn, New York. This completes our graduating pediatrics OMICO class for 2020. The next program is psychiatry and will be presented by Dr. Stephen Brasso.
Hello, I'm Dr. Stephen Brasso. The psychiatry residency program matriculated our first resident in 2017. These residents have worked exceptionally hard through the trials and tribulations of being in a new program and all the hiccups that occur in a young program. Our program is better and stronger secondary to their contributions. They have truly been a pioneer class, and for that I am grateful. They will make a fine addition to our psychiatric community and improve the care of our patients in Oklahoma. Our first graduating class of 4 residents are completing the program this year. I am now proud to present this year's graduates. Jennifer Brady, who will be doing an addiction psychiatry fellowship at the Medical University of South Carolina in Charleston, South Carolina. Heather Jones, who has joined the Jack C. Montgomery VA Medical Center in Muskogee, Oklahoma. Brandy Kalami, who has joined the Veterans Administration in Fayetteville, Arkansas. And Dr. Dustin Smith, who has joined the Veterans Administration in Tulsa, Oklahoma. This completes our graduating psychiatry class for 2020. Congratulations, graduates, and good luck. The next program is Diagnostic Radiology and will be presented by Dr. Donald von Borstel.
Hello, I am Dr. Donald von Borstel. I'd like to congratulate Dr. Matthews and Dr. Batista for completing a very grueling diagnostic radiology residency training program, and for also being the first of our graduates to take the ABR core board exams. They both passed the core exams successfully and without any issues. It's been an honor training Corey and Leo in the practice of radiology, and I know they will be a great representation of OSU and our training program in their fellowships and future careers. I look forward to seeing where their careers take them after fellowship. Dr. Matthews will be heading to Cincinnati Children's Hospital for a fellowship in pediatric radiology and a second-year fellowship in pediatric interventional radiology. Dr. Batista will be heading to the Cleveland Clinic for a fellowship in musculoskeletal imaging. Congratulations to a job well done, and good luck in your fellowships. The next program is surgery and will be presented by Dr. Hal Robbins.
Hello, I'm Dr. Hal Robbins. The surgery residency program matriculated our first resident in 1948. Since that time, we've graduated a total of 105 residents. We have 3 residents completing the program this year. I'm proud to present this year's graduates. The first is Brian Bergstrom, who has joined Claremore Indian Hospital in Claremore, Oklahoma. Next, we have Kristen Boyer, who will be doing a cardiothoracic surgery fellowship at Brigham and Women's Hospital in Boston, Massachusetts. Last, we have Jared Lepley, who has joined St. Anthony Hospital in Oklahoma City, Oklahoma. This completes our graduating surgery class for 2020. The first fellowship program will now be presented by Dr. Samuel Martin, Addiction Medicine.
Hello, I'm Dr. Samuel Martin. The Addiction Medicine Fellowship Program matriculated our first fellow in 2019. We've had an excellent first year of fellowship and a great fellow filling those shoes of the first fellow. We have our first fellow completing the program this year. I am now proud to present this year's graduate. Our first graduate is Lowell Robertson, who has decided to join Oklahoma State University Center for Health Sciences in Tulsa, Oklahoma after the completion of his fellowship. This completes our graduating addiction medicine class for 2020. The next fellowship program will be presented by Dr. Daniel Wilds, cardiovascular disease.
Hello, I'm Dr. Dan Wilds. The Cardiology Fellowship Program matriculated our first fellow in 2003. Since that time, we have graduated a total of 26 fellows. This year, we have 3 fellows completing the program. I'm now proud to present this year's graduates. First is Dr. Dan Bergeron, who has joined St. Peter's Hospital in Albany, New York. Second will be Dr. Farouk Junaid, who has joined Blessing Hospital in Quincy, Illinois. And last, we have Dr. Ian Parker, who will be doing a cardiac electrophysiology fellowship at the University of Oklahoma in Oklahoma City. This completes our graduating cardiology class for 2020. The last fellowship program will now be presented by Dr. Steve Kim, Program Director for Interventional Cardiology.
Hello, I'm Dr. Steve Kim. The Interventional Cardiology Fellowship Program matriculated our first fellow in 2006. Since that time, we have graduated a total of 13 fellows. We have 1 fellow completing the program this year. I am now proud to present this year's graduate. Kaiser Sikander has joined the South Florida International Cardiology Consultants in Miami, Florida. This completes our graduating interventional cardiology class for 2020.
That concludes the presentation of the 2020 graduating residents and fellows. We all can be extremely proud of this outstanding class. We wish them the very best as they continue their careers and dedicate their lives to serving the patients of our nation. Our gratitude must also go out to the faculty, administration, and all the other hospital personnel who over the last 75 years have played a role in the education of our interns residents, and fellows. I would now like to turn the podium over to Dr. William Pettit, Chair of the Graduate Medical Education Committee of OSU-CHS and OMICO, and also the Dean of the Cherokee Nation campus of the OSU College of Osteopathic Medicine. He will now give some final concluding remarks as our 75th graduation ceremony comes to a close. Dr. Pettit.
Thank you, Dr. Blankenship, Dr. Slick, and Dr. McCullough for your remarks, and congratulations to all the 2020 residents and fellows on this 75th anniversary of graduations at the Oklahoma State University Medical Center. As the chair of the Graduate Medical Education Committee, I wish you all a rewarding and successful practice or fellowship as you move forward in your new phase of your medical careers. Thank you all for attending, and this concludes our graduation ceremony. Be safe and good evening.